Hello, I'm Dr. Mike Koriwchak. A bunch of my patients have suggested that we take our post-op instructions for a thyroidectomy and make a video out of it. So we thought that was a great idea. So we'll give this a shot and see if it helps making understanding of what a thyroidectomy is like after you go home. So I've got my notes here, and I've got Savannah here behind the camera who's going to keep me out of trouble and hopefully make sure I don't forget anything. So when you start, you'll wake up and you'll have an incision across your neck, sort of in a skin crease, sort of right about here, and it'll be covered with this stuff called Dermabond, which acts like a one-time Band-Aid. So as soon as you're done, the incision's waterproof. You can get it wet in the tub or the shower, and you put a little sunblock on it in the early days, and that will take care of that sort of thing. So when you get home, you're going to go home with 3 prescriptions if we take your entire thyroid gland out. You're going to have 1 prescription for pain, of course, and you're going to have 2 medications to help support your calcium level for the first few days after surgery. So the pain medicine, of course, you take as you need. The calcium is 2 of each kind of pill. You're going to have 2 pills that are sort of a high-octane vitamin D and 2 pills that are calcium that are kind of big. So you'll take 2 of each of those twice a day to keep your calcium levels up until everything kind of heals up inside your neck. In terms of what you can eat anything that you like. I wouldn't push the diet too much the first few hours after surgery because you might get sick to your stomach and that wouldn't be good. But there's nothing that you absolutely can't eat once the anesthesia is out of your system in a day or so. There's no restrictions to what you eat or drink. The incision doesn't require a lot of care because that Dermabond is all sealed up, so you don't have to have any ointment, for antibiotic ointment or anything like that, and there's really not much to do to it except keep some sunblock on it if you go outside. Restrictions on exercise we get asked about a lot, so it really depends on what you do for a living. You know, you can go back to a non-physical job in a couple of days, or you can stay out longer if you wish. It's really a matter of what you do for a living. We don't want you lifting anything over 10 pounds for the first 10 days, and don't want you driving until you can turn your neck like this without having any pain so that you can look side to side and change lanes and that sort of thing. But as soon as you're off of narcotic pain medicine, which shouldn't take more than a couple of days, then I'm okay with you going back to a non-physical job, except maybe for the driving, if you can arrange to have somebody drive you for a few days. If you're a mom and you're taking care of young kids, you're going to need to get some help because I don't want you picking up your little ones or having to save them from falling down or something, so you're going to need some help for that for a while. So how long you're out of work sort of depends on your occupation. More physical jobs, you're going to be out of work a little bit longer. So aside from that, not a whole lot that you have to do. We talked about eating restrictions. We'll see you back here in the office in a week. And at that point, we'll look over your pathology report. That's the lab analysis of your specimen that we take out of the neck, the thyroid gland. We'll check your incision. We'll start taking some of that Dermabond off, and we'll talk about your path report and get you on thyroid hormone if you need it. After the single post-op visit, we don't do a whole lot more, but obviously if there's troubles after that visit or we need to look at your neck or something, then we're always glad to see you back and have a look at things if we have to. But typically, we're going to let you go back to the care of your endocrinologist. People like to know what to look for. You know, what are the signs of trouble? What things do you need to call the office for and ask us about so we can go through those. If you see any sudden increase in swelling in the neck or any discoloration in the neck, or you notice any sudden change in what your swallow feels like or what your breathing feels like, then you may have a little bit of bleeding under the incision, and we need to know about that right away. If it suddenly hurts a lot more than it did, that's another indication we need to look at something. If you get a fever, that's not unusual after surgery, and if it's below 100.5, it'll probably go away with a little bit of Tylenol or get up and move around some. If your fever gets up towards 101, probably a good idea to give us a call to see what's going on. If you notice any tingling around the lips, tingling in the fingertips, or muscles getting tight or twitchy, that means that your calcium is probably getting a little low, and we need to know about that. Although the first thing that you can do right away, in addition to calling us, is to take an extra dose, 2 of those vitamin D pills and 2 of the big calcium pills, because if you take that and you don't need it, it's not going to hurt you, but if your calcium is low, it's the fastest way to fix it. Savannah, how am I doing? Am I forgetting anything?
What medications can they take after surgery other than the ones you give them?
Well, we like to keep you on all of your regular medicines. If you have blood pressure medicines or medicines for diabetes or medicines for cholesterol or that kind of thing, you can take all of those. If for surgery, we probably took you off your aspirin or any other blood thinners. So we'll probably need to keep you off of those for 4 or 5 days following surgery. But some of that depends on why you're taking it. If you're taking the blood thinner because of blood clots in your legs or a heart condition, then we'll probably get you started back on those medicines sooner, because we certainly don't want you to have problems with any of those things that you're taking the blood thinners for in the first place. So I think that's most of what we cover when we see you and prep you for a thyroidectomy and talk in your post-operative visit. If I forgot anything when you're reaching the video or watching the video, please let us know. We'll probably end up redoing this once in a while, but thanks for your time and attention.